Good afternoon, everyone. This is Rachel Castillo. So my report is all about climate change and vector-borne diseases. So for the introduction, we have vector-borne diseases are infectious diseases that are transmitted to humans and other animals by parasites, viruses, and bacteria that are transmitted by vectors. So vectors are living organisms that can transmit infectious pathogens between humans or from animals to humans. Many of these vectors are blood-sucking insects, which ingest disease-producing microorganisms during a subsequent bite from an infected host, and later transmit it into a new host after the pathogen has reproduced. Climate change can cause vectors or the diseases they carry to spread more rapidly and to new areas if possible, putting the population at risk. So climate change can bring fear to human exposure to vectors-borne diseases and uncertainties about the spread of vector-borne diseases, especially in areas with rising global temperatures, those at risk in increased rainfall, flooding, and human migration. Changes in temperature and humidity can affect the development and dynamics of the disease vectors and the cycle of the pathogens they carry. According to the WHO, there are three components that determine the occurrence of vector-borne diseases. The first one, we have the vector and the host abundance. Second one is the local prevalence of disease-causing parasites and pathogens. And the last one is the human population behavior and disease resilience that fully support the aforementioned uncertainties. Climate change relates to the vector-borne diseases by means of the first one, we have drought and heat, where virus activity often appears to be greatest during La Nina conditions and our hot summer temperatures. Second, we have wet conditions where prolonged rainy seasons could make an area more at risk for the introduction and establishment of exotic vectors such as those that carry dengue and yellow fever. WHO estimates that rising global temperatures as well as altered precipitation and human humidity linked to climate change could significantly alter vector-borne diseases and their effect on human populations, making epidemics more difficult to predict and control. The changes in vector-borne diseases would likely occur as both short-term epidemics and long-term gradual changes in disease trends. Indeed, a changing climate will allow vectors to exist where they previously not. Changes in climate change make these interactions less predictable, multiplying the risk of the disease. So for the objectives, we have the first one is to raise awareness about different types and examples of disease vectors present in the environment. Second, we have to identify what diseases these vectors may inflict. The third one is to establish preventive measures to minimize the negative impacts of vector-borne disease and reduce vector reproductions. So, vector-borne diseases affects human illnesses caused by parasites, viruses, and bacteria that are transmitted by vectors. It may be zoonotic disease. Examples of zoonotic diseases are we have the very common rabies, salmonellosis, and anthrax. So I will discuss the main vectors and the disease it may transmit. The first one, we have mosquito. So we have chikungunya, malaria, and dengue fever. So for each diseases, I'll give you a short introduction of each. The first one, we have chikungunya. So chikungunya is a viral disease transmitted by mosquitoes that causes sudden onset of fever and severe joint pains. Other symptoms may include fatigue, muscle pain, headache, and rashes. And the signs and symptoms usually appear within 2 to 7 days after bitten by an infected mosquito. And the second one, we have the malaria. As we all know, malaria is a serious and sometimes fatal disease caused by the parasite that is commonly infects a certain type of mosquito which feeds on humans. People with malaria are typically very sick and with high fever. Also, we have shaking chills and flu-like symptoms. And the third one is the dengue fever. So dengue is a mosquito-borne tropical disease caused by dengue virus. Symptoms typically begins within 3 to 4 days after infection. This may include a high fever, headache, vomiting, muscle ache, and joint pains and skin rashes.